The creation of MQ 10 years ago, with an exclusive focus on research, was a timely step towards trying to resolve a national mental health crisis with 1 in 4 people affected. Mental health research is hugely underfunded, and that means our understanding of it is way behind compared to physical health. If you look at the numbers, only £9 is spent on mental health research per person affected in the UK, compared to £228 per person affected spent on cancer research.
Where do we need to start? Where are the key things we need to focus on? So one thing in terms of the landscape is people realising how important things like children and young people's mental health is. And there's a kind of window of opportunity, essentially, if we can understand what's happening at that point, since so much of mental illness starts at that kind of age below 18 or below 24.
Groundbreaking discoveries could aid intervention even before birth. MQ's global footprint, connecting scientists with donors, means it can invest in cutting-edge research via funding initiatives like the MQ Fellows Programme.
So the project that I had in mind, I thought I would give it a try and send it to MQ to see if they might be interested in working together. And it's just been a fantastic journey since then, both scientifically and in working with MQ.
Dr. Rothman's project showed that folic acid, already known to offer protection against some neural tube defects when taken in early pregnancy, might also help guard against changes in brain development that could lead to mental illness in later life.
This funding allowed us to do it in a way that was fairly conclusive and allowed us to replicate our results in a different population. That helped us to confirm that it was a real and robust finding, and there's no way that would have happened without MQ.
Networks like DataMind are important to ensure health data can be collected from marginalised groups, so they are not excluded from research. Supported by MQ, the Adolescent Data Platform has compared the health records of over 400,000 children with school records of absences and exclusions.
What we showed, very unsurprisingly, was that there's a really strong association between mental health problems and being absent or excluded from school. So children who were excluded from school were 7 times more likely to self-harm up to the age of 24.
The study led to new mental health guidelines for schools. But Professor John believes young people and children are often not included in data gathering, and that, combined with underfunding, can lead to their mental health needs being overlooked.
We feel that all the time, and I think it's slightly changed over the last 2 or 3 years because awareness about the importance of mental health has increased. But it's still really underfunded. And then, within that underfunding, there are things that are even more underfunded. And I would say children and young people. And then I guess the other 2 that are underfunded is severe mental illness and then suicide and self-harm prevention.
Suicide is an area MQ is already working on with Professor Rory Connor, a long-time collaborator who is now scoping further prevention work.
With funding from MQ, for the first time ever in the UK, we tested whether a very brief intervention called SafeTel is effective in reducing risk of suicidal behaviour in those who are most vulnerable. Now, what I mean by SafeTel, or safety planning, is it's a 6-step brief intervention which you work collaboratively with somebody who's suicidal to help them to identify the warning signs that a suicidal crisis might be escalating.
Besides other early death prevention initiatives, the charity is also leading the way on improving research into mental health interventions and treatments, as well as offering practical advice. Its Fellows programme is being extended, and they're making sure that mental health remains on the national agenda, with collaboration the way forward.
MQ does a lot of bringing all of those different voices together from the research world, but also the service provision side, the stigma fighting side, really trying to make sure those charities are working together and therefore having a stronger voice.